occupational English test. Listening test. This test has 3 parts. In each part you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information you hear. Now look at the notes for Extract 1. Extract 1. Questions 1 to 12. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Hello, Rebecca. How are you today?
Dr. Miller, I'm still having problems holding my urine until I get to the bathroom. I'm leaking before I can make it to the toilet, so I've been wearing these bulky pads. I have to wear them. My desk is at the other end of the office, far from the bathroom.
I see. Well, the last visit you said that you are not leaking urine when you cough, sneeze, exercise, or lift something. Has that changed?
No, I don't leak at those times. I'm just feeling this urgency to go and rushing off to the bathroom 10 or 12 times a day. It's a nuisance because I'm so busy at work these days.
Well, we've ruled out bladder infection and other bladder problems. It seems that you have a type of urinary incontinence called urge incontinence. It affects women across all age groups. Likely the muscles that you use to hold your urine are weak. Well, the good news is that there are treatments that work to help you to become continent.
Continent?
Continent, being able to hold your urine until you go to the bathroom. And even if you aren't continent 100% of the time, treatment can mean fewer times when you leak urine by accident.
That would be nice. How is this treated?
Well, there are quite a few non-surgical treatments for urge incontinence. Some lifestyle or non-drug treatments include bladder training or a medical device called percutaneous tibial nerve stimulation. Then there are medications.
There are a lot of choices. Could you go over the options?
Sure. With the bladder training, you hold your urine for longer and longer amounts of time.
I see.
With nerve stimulation, a thin needle is inserted near your ankle. Pulses of electricity stimulate the nerves in your leg that connect to the nerves that control your bladder muscles. And prescription medications can reduce your incontinence or eradicate it completely.
It's a lot of choices. I'm just not sure. What do you think I should do, doctor?
Rebecca, people with urge incontinence get results from all the treatments I just mentioned. But since you're busy at work and the bathroom is so far from your desk, for now, I'm going to prescribe a medication to help you with this problem.
A prescription? Well, I guess I could give that a try.
Now, I want to see you back here in about a month. Call me sooner if you're experiencing side effects from the medicines or finding that you want to do something else. I think we can get this thing worked out for you.
Hello, I'm Julian, one of the nurse practitioners here. How can I help you?
Well, Julian, I've got some pain in my sort of the lower part of my tummy, actually.
Right. Okay. And have you noticed any other symptoms apart from that abdominal pain?
Well, the pain's there sort of on and off, but then when I have a wee or go to the loo, it really hurts.
Right, oh, it hurts when you go to the toilet. Right,
Yeah.
okay. And how long have you had that abdominal pain for?
Well, I think it's been about a week really,
Right,
sort of on and off, not all the time.
for about a week, okay. What about the pain when you pass urine? How long has that been for?
I suppose towards the end of the week, and then really over the last 3 days, that seems to have got worse.
Right.
And now it feels like if I, as soon as I need to go to the loo, I've got to go. I feel like a real urgency to go, and it seems like I'm going to the toilet more often.
Right, okay. So some pain passing you in the last few days, and then more recently you've had to go to the toilet more often,
Yeah.
and you feel like you've got to go all the time.
Yeah. And in the night I now have to wake up and go to the loo.
Right, you have to get up at night as well. Okay, all right. Have you had any problems like this before? Any this type of urinary problems?
I suppose I had something sort of similar, yeah, about 2 years ago actually.
Right, right,
And it sort of felt quite the same.
right. And can you remember what that problem was?
I think they said I had cystitis.
Right.
Yeah, cystitis, and I had to have just some antibiotics.
Oh, some antibiotics. Okay. And did it go away then?
Yep, it went away, and I don't think I've had anything since.
Right. Okay. Fine. Have you still got the abdominal pain at the moment?
Yes.
Okay.
Not too bad,
Not too bad.
but it's there.
Okay.
It's just sort of in the background.
Okay. Is it there all the time? Or does it go up and down?
I think it goes up and down really, but worse perhaps when I am having a wee.
Okay. On a scale of 1 to 10, with 10 being the worst, how would you rate the pain?
It's not that bad. I think it's probably about 4.
About 4.
3 or 4.
Okay, so not so bad. Okay. Have you taken any medicines at all for this problem?
Well, I did take a couple of paracetamol,
Okay.
and that seemed to help with the pain, but obviously it doesn't stop me needing to go to the loo all the time.
Right. But it helped with the pain a bit. Okay. Good. All right. Now, I just wanted to ask about some other symptoms related to this. Have you had any fever at all, like feeling hot?
No.
No. Have you felt sick at all? Or any vomiting?
No.
Okay. Have you noticed any blood in the urine?
Oh, no.
No? Okay. That's
Should
good.
I?
Well, if you did, then we'd want to do something
Oh,
about
no.
it. But if you haven't, that's fine. Okay. And have you noticed any unusual vaginal discharge at all?
No, just the same really.
Just the same. Okay. And any unusual vaginal or vulval irritation or spots or sores since you've had this problem?
No, just the sort of pain that feels like it's inside when I'm having
Right.
a wee, but I haven't noticed anything. So.
Okay. Fine. Okay. And do you have a partner at the moment?
Yeah, I'm married. Been married 5 years nearly.
5 years, okay. Right. When did you last have a sexual health screen?
I think it was, when before we started going out with each other, so
Right.
as we were going out, which is probably about 6, 7 years ago.
Right, okay. All right, fine. And I need to ask this question in relation to possibility of sexually transmitted infections, but have you had any other sexual contacts
No,
recently?
I haven't.
No. Okay.
Oh,
Well-
maybe my husband has.
Okay. Well, we're just
No.
checking to see if there's any risk for sexually
I don't
transmitted
think so.
infections. Okay, that's fine. And I just need to ask about your period as well. When was the first day of your last period?
What date is it today? About 2 weeks ago.
2 weeks ago. Okay, was that as normal, do you
Yeah,
think?
normal.
Okay. Do you
No
think there's
problem.
any risk of pregnancy?
No, because I have an implant.
Right, okay. Fine, okay. That's all right. Now, so how often would you say you're going to the toilet during the day?
Oh, it feels like I could go every 5 minutes,
Right,
really.
right.
I don't know.
Okay.
Quite more than I would normally go.
Right, okay. And have you been able to go to work, or you've had to take time off?
Well, since it's now feeling like I might wet myself if I don't get to the loo
Right.
quick enough, I've taken the last two days off,
Right.
just because I work in a really busy office and I can't bear the thought of that happening at work.
Okay, fine, all right. Okay, so you've mentioned that you've had cystitis before in the past and you had some antibiotics for that.
Yeah.
I just want to ask about some past medical history problems. Have you any other illnesses or operations in the past that I should know about?
No, nothing really. always been really healthy. I
Okay.
mean, I had this sort of cystitis thing 2 or 3 years ago. But other
Okay.
than that,
All right, fine. Okay, so I just wanted to ask about medicines as well. You mentioned that you're taking paracetamol
Yes.
for this problem, and that got an implant as well. Do you take any other medicines?
No, I mean, sometimes I might take ibuprofen if I needed to,
Right.
but nothing regularly.
Okay,
No.
fine. And are you allergic to any medicines
No.
that you're aware of?
No,
No. Okay.
not that I found out.
Fine. And what sort of job is it you do?
Well, I work in an office, but I'm just a secretary.
Right, you're secretary in an office.
Mhm.
Okay. And you're married.
Yeah.
Have you got any children?
No.
No. Okay. All right. And just thinking about your weekly alcohol intake, how much do you think you would drink normally?
Not very much, really. Probably a couple of glasses a week.
Right.
Sort of just depending on what's going on, but most weeks probably minimal.
Right. Okay. Okay. Good. And what about smoking?
Well, I've been really good. I
Yes.
used to smoke.
Oh, okay. Yes.
I think 3 years ago now I stopped and I haven't smoked
Right.
since.
Okay. Oh, that's good. That's good. Well done. Okay. And what about exercise? You take any exercise?
On a Monday night after work I go swimming.
Yes.
And I do walk my dog sort of
Right.
2 to 3 times a
Okay.
day.
Yes, that's good.
But nothing else. Really.
All right. That sounds okay. All right. And have you had any travel anywhere recently, say outside of the
No.
UK?
We're going in a couple of months, but we did actually go. I think our last holiday we just went to Ibiza last
Right.
summer.
Okay. Fine. So nowhere exotic, really.
Very
Okay. And what were you thinking this problem might be? Did you have any
Well,
thoughts?
It seems very similar to what I had a couple of years ago, really. So I think maybe I've got cystitis or a urine infection.
Oh, right. Okay. Yes, it does sound a bit like that, doesn't it? Yes. Okay. And what were you thinking to do about the problem today?
Well, as it worked so well before when I had the antibiotics, I thought maybe I should have some antibiotics because it doesn't seem to be getting better.
Yes.
It's getting worse, really.
Okay. Fine. All right. Okay. Well, I think that's the end of my questions I want to ask you. So that was the end of my history taking station. So I'm just going to switch the video recorder off.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B or C which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. You hear a doctor explaining to his patient about a bone marrow biopsy.
Doctor, I was told to undergo a bone marrow biopsy and I'm very worried about this test. Can you suggest how I need to prepare for this?
Well, a bone marrow biopsy is normally advised to diagnose and monitor a variety of conditions. It can also be performed to diagnose or determine the extent of certain types of cancer. A bone marrow biopsy is performed through the procedure called a bone marrow aspiration to obtain a sample of the bone marrow, which is the blood-forming portion of the inner core of the bone. Usually, a bone marrow aspiration is taken from the pelvic bone called the ilium. That can be accessed from the lower back near the hip. The sample can also be taken from the center bone in the chest called the sternum, or the front of the pelvic bone near the groin.
Question 26. You hear 2 hospital managers talking about an information session for people who want to do voluntary work.
So, how's the planning going for the future volunteer information evening?
Well, we've had a lot of RSVPs already, so I'm really happy with the way the event management systems have worked. Having a bit of trouble sourcing some good catering, though. Considering that these people are freely giving their time to come and learn what is expected, I really want to provide some nice food and refreshments for them. Have you got any contacts you like using?
Yeah, look, that's right. It's a small thing we can do for those participants. I'll tell you what, I'll ask around my team for some recommendations for something a bit special.
Great, thanks. I really appreciate it.
Question 27. You hear a discussion between a nurse and a doctor on different categories of chemotherapy drugs.
Hello, doctor. What are the different categories of chemotherapy drugs?
There are several types of chemotherapy drugs that vary both in their functioning and on which part of the cell cycle they work. Alkylating agents are nonspecific drugs that directly damage DNA. Examples include Cytoxan and Myloran. Antimetabolites work by pretending they are nutritional sources for the cell. Cancer cells take up these drugs instead of nutrients and essentially starve to death. Examples include Navalbine, VP16, and Gemzar. Plant alkaloids include drugs obtained from plant sources. Examples include Cosmogen and Mutamycin. Anti-tumor antibiotics differ from the types of antibiotics used to treat bacterial infections. These drugs work by preventing cancer cells from reproducing. Examples include Adriamycin and Cerubidine.
Question 28. You hear a discussion between a doctor and a nurse about pancreatic neuroendocrine tumors. Now read the question.
Doctor, what are the various types of pancreatic neuroendocrine tumors?
There are different kinds of functional pancreatic neuroendocrine tumors. Gastrinoma usually forms in the head of the pancreas and sometimes forms in the small intestine. Most gastrinomas are malignant. Insulinoma forms in the head, body or tail of the pancreas. Insulinomas are usually benign. Glucogenoma forms in the tail of the pancreas. Most glucogenomas are malignant. VIPomas, which make vasoactive intestinal peptide. Somatostatinomas, which make somatostatin.
Question 29. You hear a monologue by a physician explaining about gallstones. Now read the question.
Gallstones are formed due to an imbalance in the composition of bile, resulting in hard stones that are made of pigment or crystallized cholesterol, or a mixture of the two. They can range in size from as small as a sand grain to as large as a tennis ball. One can have a single large gallstone, dozens to hundreds of smaller gallstones, or a combination of both small and large stones. There are two types of gallstones. Typically, patients with pigment stones have cirrhosis of the liver, biliary tract infections, and hereditary blood disorders, including sickle cell anemia. These are all conditions that produce too much bilirubin, of which the stones are made of. Pigment stones tend to be dark brown or black. Cholesterol stones are formed as a result of bile that is made of too much cholesterol or bilirubin and not enough bile salts. They can also form when the gallbladder fails to empty during the digestive process. They are usually yellow-green gallstones, which are the most common type.
Question 30. You hear a doctor briefing the junior doctors about trigger point injection. Now read the question.
Trigger point injection. Often muscle spasm prolongs and doesn't respond to regular treatments like ice and heat, physiotherapy, or muscle relaxants. In order to relax the muscle, either a local anesthetic or a combination of local anesthetic medication and a steroid medication will be injected into the tight bundle of muscles known as trigger points. In this process, the skin of the patient will be cleaned and chlorhexidine and a small needle will be inserted into the trigger point muscle. Generally, up to 4 trigger points are injected in one session. However, when injecting up to 10 trigger points, the patient will feel very painful. It is essential for the patient to inform the physician when the needle contacts the painful trigger point, as this is where the medicine has to be injected. They may feel a temporary discomfort. There can be many possible complications after a trigger point injection, including mild bleeding and skin irritation and infection. Although the positive result of the treatment cannot be ascertained, the local anesthetic will numb the area for 3 hours. The corticosteroids remain in the tissue in active form for about 1 month.
Part C. In this part of the test, you'll hear 2 different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B or C which fits best according to what you hear. Complete your answers as you listen. Now look at Extract 1. Extract 1, questions 31 to 36.
The way that we teach clinical history taking at Warwick Medical School is to use the 4 frames. And the 4 frames are a logical way to take a comprehensive history and not miss anything out at all. So the first frame is a presenting complaint and the history of presenting complaint and the systems review and the red flags. So we encourage our students to ask an open question so they can start eliciting the symptoms from the patient. Then we would click into one system. What I mean by that is that if somebody has chest pain, for example, then you would clearly need to ask about all the cardiac symptoms once you've got a lot of detail about the patient's pain using a mnemonic such as SQUITAS, which is site, quality, intensity, timing, aggravating factors, relieving factors, and associated symptoms. I think then it's very important to ask about other systems. So we would do a systems review and then finish off by recapping the red flags. That is, for example, blood anywhere, lumps and bumps anywhere, weight loss, change in appetite, change in bowel habit. The next frame could be the past medical history. We'd ask about operations, any other significant serious conditions. They would ask about the drugs because they would often be related to the past medical history. And they would ask about over-the-counter drugs as well, and also check on recreational drugs. We will then move on to check allergies and food intolerances. With respect to allergies, it's very important to ascertain whether the patient has any allergies such as to penicillin and what the nature of that allergy or reaction is. The third frame is a social history. So we'd explore the patient's social history, we'd find out how these patient's symptoms and conditions are impacting on the patient's life and occupation. We'd also need to inquire about smoking, alcohol, home circumstances as well, and occupational factors. We'd also then need to move on to the family history, particularly in relation to the presenting complaint and other serious conditions that could run in the family, such as cardiovascular disease, hypertension, or diabetes, or even asthma. The final frame is to explore the patient's values. Why is the patient worried about their condition? So there we would need to explore the patient's ideas about what they think is going on, what concerns them most, and also to ask them about their expectations of how we can best help the patient. Then there should be an opportunity at the end to let the patient ask you further questions, but also if there's any bits of information that they would like to give you. Then usually at the end, it's a good idea to recap the main features of the history back to the patient just to check that you've got all the main facts. And then you could move on to a discussion about the management, which would include an explanation of what's going on, investigations, and follow-up.
Which comes from Mel, who asks if soy milk is messing with our hormones and if there are healthier milk alternatives. We're joined by Olivia. Willis.
Hi, Michael.
A lot of us tend to think of soy milk, Liv, as a healthy option. You can find it in the health food aisle of many major supermarkets. What's it actually made of?
It's funny, a lot of us do tend to think of soy milk as, and I guess any other kind of plant-based milk as a healthier option or a health food. And it's certainly a lot of reason that people make the switch now, not just because they're, lactose intolerant or maybe they want to reduce their carbon footprint. But soy milk, it's essentially made from soybeans and filtered water. So it's kind of taking the milk from soybeans that have been pressed, or in some cases, manufacturers will use a soy protein powder. Mm-hmm. And then they add in things like oils and sweeteners and salt to get it to that similar kind of consistency and flavour as cow's milk. And it's also normally kind of fortified with calcium and vitamin D and certain B vitamins, just so it becomes a good, substitute for cow's milk and a good source of calcium.
Okay, so how does it compare nutritionally to regular cow's milk?
Well, nutritionally speaking, it's pretty on par. Soy milk that's fortified is fairly similar to dairy milk, and that's most of the soy milk that we'd find in the supermarket. There's no reason why anyone needs to have dairy milk or cow's milk, but it's certainly a good source of protein and calcium, and it's an easy way, I guess, to get a lot of those nutrients that we need in our diet. That's kind of why it's been a cornerstone of Western diets for a long time. Cow's milk is generally, it's naturally a better source of calcium. But like I said, because most soy milks are fortified now with calcium, they're a really decent substitute for cow's milk. Soy milk's a good source of protein, and soy products, should be a good part of a kind of healthy, balanced diet.
What about fats, comparing milk with milk?
Yeah, so soy milk is it doesn't have, the same, it's lower in fat, it's lower in saturated fat, but milk products generally are fairly low fat. And I guess if you're concerned about the fat content, you've got kind of skim milk as an option, but that is something, I guess, to take into consideration, that yes, soy milk is lower in fat content.
So soy is also lower in fat, but as I think you mentioned, it's fortified, so along with the natural qualities of soy itself. So you've got iron and fibre, other vitamins and minerals. So is there a kind of recommended blend between dairy and soy in your diet?
Look, I think it's really personal choice. Like, soy is definitely the best kind of substitute for cow's milk. If you're going to not have regular cow's milk in your diet, then soy would certainly be the best option, in contrast to other plant-based milks, like
Oh,
those
really?
almond milks. Yeah, absolutely.
Okay,
By a long shot.
Well, we'll go back to some of those other milk alternatives in a moment, because a lot of people are opting for those too over soy and dairy. But just back to Mel's original question, she was asking, is soy milk messing with our hormones? And what's the science saying there?
Yeah, so people are a little concerned. There was concern some years ago about this. So soy products contain these things called phytoestrogens, and they're kind of naturally occurring plant chemicals that are chemically pretty similar to the body's natural estrogen, but they're of a much weaker scale. And soy is not the only food to contain them, but it does have a high concentration of them. And so I guess the discovery of phytoestrogens in soy products led to concerns that they would kind of mimic the effects of our body's own natural estrogen and potentially disrupt our hormones. And there was a particular concern that was raised some years ago when researchers found basically that these phytoestrogens could increase the risk of cancer in rats. But it's very important to point out that animals, rats have a very different metabolism to humans, and studies in humans do not point to any kind of harmful effects.